Hi, everyone, and welcome to today's webinar. We're very happy you could join us. My name is Brianna Humphreys, and I'm the Marketing Manager for K-12 Education Products at Brooks Publishing. Before we get started, I just want to go over a few housekeeping items. So you will be muted for the webinar, but if you have any questions during the presentation, please feel free to type them into the question box you'll see in your GoToWebinar control panel. We will take these questions after the presentation during the Q&A portion. For the presentation, you might want to minimize the GoToWebinar bar on your monitor so you can see more of your screen. You can do that by clicking the orange button with the arrow in the top corner of the control bar. If you need to enlarge the bar again to ask a question, you can just click that orange button again. If you have any audio issues at any point, you can switch to phone by clicking in the audio section of the webinar panel and using the dial-in information provided. Just a quick housekeeping note, we are recording today's webinar, so everyone who registers for the event will be receiving a link to the recording in a follow-up email tomorrow. So from Brooks Publishing, we're really excited to announce that we are giving away 3 copies of Dr. von Hahn's book, Essential Skills for Struggling Learners today. Winners are going to be randomly selected from today's live attendees, and we'll notify you after the webinar via email. So if you want to increase your chances, feel free to submit a question in the questions pane in the GoToWebinar control panel. So today's webinar is on executive skills and ADHD, and we're really happy to have Dr. Erik von Hahn here with us today to cover this important topic. Dr. von Hahn is a developmental behavioral pediatrician who works with children and youth with diverse disabilities. In addition to his clinical role, he is an educator in the university setting and acts as a consultant to school districts and to healthcare professionals. His medical qualifications include specialized training in pediatrics, developmental behavioral pediatrics, and child psychiatry. Successful service to children with disabilities occurs when adults can work successfully with one another. All of Dr. von Hahn's clinical and teaching encounters emphasize service to children with disabilities by seeing their world through their eyes and by fostering collaboration among home, school, and clinic. Dr. von Hahn, thank you so much for being with us here today.
Brianna, thanks for including me. I've just put on my webcam. I want you to have a face to look at while I talk through my talk. Welcome to my office. I'm in Boston, and we're all in shutdown here, but we're all doing okay. I'm going to take myself off the screen. This is the title of the talk. It's ADHD and Executive Skills. There's actually quite a number of skills under the umbrella of executive skills, and we're really only going to have time to talk about impulse control or inhibition and working memory. This is the title of my book. It was released in November. It's called Essential Skills for Struggling Learners. It could have been called Essential Skills for Learning. And it says that it's a framework for student support teams, but really it's a set of frameworks. And these are the 11 frameworks that make up the book. All of these skills here are things that school teams are routinely evaluating. I've highlighted skill number 7. It's the framework for executive skills. And if you were to open the book to chapter 7, you would see the executive skills framework. I want to go quickly through this before I get back to the title of the talk. The executive skills framework has these 8 components to them. Executive skills are very interrelated. Each of the skills that's listed on the list is kind of related to the other, so they're hard to separate out as individual skills. The first 2 are skills that emerge in infancy and during the first year or so of life. The next 3, numbers 3 to 5, are the ones that really emerge in preschool and the early school years. I've highlighted inhibition and working memory because those are the 2 that we're going to talk about today. There's some really interesting information about shifting cognitive set that I'd love to share, but I had to pare the talk down to something manageable. So we're just going to focus on numbers 3 and 5. The next ones, planning, organization, and metacognition. I think a lot of people think that executive skills are about planning and organization, and they certainly are, but planning and organization depend very highly on the development of the first 5 skills, and in fact, in particular, the skills from 3 to 5. And those are the ones that we think are the most affected in kids with ADHD. So here we go, back to the title of the talk, ADHD and Executive Skills. What I want to remind you all is that ADHD is defined behaviorally. There's no blood test or X-ray or CT scan that you can do to identify it. The DSM, the Diagnostic and Statistical Manual of Mental Health Disorders, uses observable behaviors to identify children with ADHD or any other condition. What's important, though, is you have to be able to interpret the behaviors to come up with a diagnosis. I'm going to go back for 1 second. The behaviors that you can see in ADHD are the ones that I've listed here. Those of you who are in practice will probably have filled out a Vanderbilt teacher rating scale at some point in your life. And the skills here, the behaviors here, numbers 1 to 9, are behaviors that are highly characteristic of kids with ADHD. So fails to give attention to details or makes careless mistakes, has difficulty sustaining attention, etc. I don't want you to read through each of those. The slide is a little bit busy. I'm going to show you another busy slide, which is symptoms from 10 to 18. But as is true for any DSM condition, you have to interpret the behaviors. So you're seeing the behavior in the classroom, and then you have to think, well, what's the cause of the behavior? How does one best explain these behaviors? The explanation of the behaviors leads you to the diagnosis. So in this case, ADHD. But what I think is really underemphasized is how the interpretation also influences what you're supposed to do. So your interpretation of that long list of behaviors, if you're going to interpret that as being due to ADHD, really what you're saying is you're interpreting that as being due to problems with executive skills. And once you've decided, okay, those behaviors are due to impulsivity or they're due to poor working memory, for example, that starts to lead you towards the intervention plan. The book is written that way. So each chapter has observable behaviors that then have to be interpreted. And sometimes you have to interpret the behaviors using the language skills framework, and sometimes you have to interpret it using the social skills framework. The framework that we're going to be using today is the executive skills framework. So let's do that. Let's look at some of these observable behaviors a little bit more closely, and then decide how the concept of executive skills can help to explain those behaviors. So one of the behaviors that's listed in the DSM is that children with ADHD have difficulty sustaining attention. Well, sustained attention requires the ability to inhibit distractors. If you can't inhibit distractors, then you're going to have difficulty sustaining your attention. Fails to give attention to details is another one of the behaviors of ADHD. Well, paying attention to details requires you to stay focused, so you have to be able to inhibit distractors, and you also have to remember the details that you're supposed to be focusing on, which requires working memory. Loses things necessary for tasks and is forgetful. Well, remembering what you need to do to get through the day requires some working memory. So these are examples of how inhibition skills or a failure to develop inhibition skills can result in the behaviors that are consistent with ADHD. I'm going to take it one step further. There's only one symptom on that list that talks about planning and organization. This is just an interesting point. In the book, I had to be really strategic about how to use those terms because they're used very differently depending on the resource. And in fact, the term that's most important here is planning. So if you're going to organize something, it requires planning skills. We often think of executive skills as being equivalent to planning skills, but really it's a whole set of skills that allow you to do planning and organizing successfully. So in the case of planning, it requires you to remember what you're supposed to do. So it requires working memory. It requires you to not get distracted from what you're supposed to remember. And you're also supposed to be able to sequence the steps or the information in the right order. We won't have time to talk about how planning affects the student's performance, the kid with ADHD, but it has a very significant impact on learning. So I'm going to pause here for a second in case you want to submit any questions. I've talked a little bit about the explanatory model that we use for ADHD, and we think of it as a problem with impulse control or poor inhibition skills, but working memory are clearly also affected. Impulse control helps to support working memory. So if you're very distracted, you tend to look like you have poor working memory. Some kids with ADHD just have a small working memory bank, and that's another component or another aspect to ADHD. So let's look at some strategies. What can the classroom staff do for students with ADHD? You can't actually improve impulse control and you can't actually improve working memory. And that's an important thing to keep in the back of your mind. These skills do improve with age. And in particular, kids with ADHD become teenagers or adults that can work around their impulsivity and their working memory difficulties. But probably the impulse control itself, it does improve with age, but it's probably never reaches, quote, a normal level. It would be hard to measure what a, quote, normal level is for impulse control. There are some data around what constitutes normal working memory. So when you're a teacher of a student with ADHD, but also when you're a parent, first thing is take a deep cleansing breath, because you really have to prepare to do extra work. The kids struggle to get through the day, whether it's the home or the school day, and they are going to require more support from you. And it's going to take a few years before the supports that they need can start to be withdrawn, okay? I think the big role that teachers can play, I certainly talk about this a lot with the parents that I work with, is to help the students to identify the difficulties that they're running into and establish some patterns or establish an explanatory model for them. So it's really important to help kids recognize when they've been impulsive or when they've been forgetful. It's important for them to know what to do when they notice that they've been impulsive or forgetful. So you have to develop repair strategies or restitution strategies. You have to have a reminder system set up for them so that they can check up on their own performance. And as the kids get older, hopefully they'll learn how to self-advocate. They'll learn how to describe their own impulsivity and their forgetfulness. They'll learn what kinds of strategies work for them, and they'll learn to advocate for people to help develop them or use them with them. Now, this is much easier said than done. Most students with attention deficit disorder would prefer not to think that they have it. Certainly as they get older into the middle school age years, they can be quite embarrassed about it, and they can get very defensive about it. And so it's depending on the age of the child or the student, it can be hard to initiate a conversation about, I'm going to help you with your ADD, because they may or may not be interested in having that conversation with you. So some of the strategies that I talk with parents that I also talk about with teachers is that first you have to really develop a good rapport with the student. Make yourself into your student's ally and friend. And if the student has had a few years of schooling and you say something like, I really like having you in my classroom, it's probably going to sell really well, because a lot of these kids get a lot of corrective feedback and they don't feel good about their performance. And having a teacher or an adult say, I really value you and I think you're a really important member of my group or my class, I think that's a really good place to start. You want to figure out what their goals are. Students all have the same goals. They'd like to be successful learners. They'd like to be socially included. So you want to make sure that you discuss some of those social goals, class citizenship goals, learning goals for the classroom, and really make yourself into their ally. I want to help you be successful. So spending some time with the student to figure out how to make yourself into their ally is a good first step. The second one is you got to then start to talk about the ADD. Now, the way you start this is by talking about some of the observations. There's a pat set of phrases that I commonly share. I've noticed that, and I wonder if. So on this slide, I'm sharing the phrase, I've noticed that. And the responses here are responses that really describe ADHD. So you sometimes share your answers before your classmates have had a chance to respond. That's called blurting out answers in other parlance. Sometimes you get out of your seat even when it's not the right time. So that's called impulsivity. Sometimes you make errors even though you know how to do the task. That's called forgetfulness or not paying attention to details. You don't always finish what you started, even though I know you know what to do. So those are all examples of forgetfulness, lack of paying attention to details, and impulsivity. Those are what I would say child-friendly or student-friendly ways of discussing ADHD with them. It's based on observable behaviors. So then you have to interpret the behavior. So you have to then say, well, why do you think those behaviors are occurring? And so you can say things that could be like, I wonder if you're one of those students who's always thinking of new and creative ideas. That's called distractibility in another world, okay? I wonder if you're one of those students who does acting before thinking. Acting before thinking is a phrase that I use very commonly in the clinic. And I give these students, the kids that I'm seeing, behavioral examples of what that looks like. I wonder if you're too excited to wait your turn. Again, that's an example of impulsivity and being overexcited. I'm wondering if you're one of those students who's a bit forgetful. Now, if you can get through all of this, build a rapport make observations and interpret observations, you're really on a good path. You can get through these first sections, because the next steps, once you have buy-in from the student, are going to become a lot easier. Okay, so have a plan. I'd like to make sure that you show everybody how smart you really are. I have a plan that I want to share with you, okay? And then you have to share your plan, okay? For the purposes of this talk, we're just going to focus on repair strategies that you can use for problems with inhibition and problems with working memory. There are more strategies than the ones that I'm able to share in this short talk, especially around planning. But have a cluster or a system of organizing these strategies in your head. So repair strategies are designed to help the student fix an inappropriate behavior. So the common one that I run into is the student makes an inappropriate remark. Oh, you know, I don't like you, or you're fat, or whatever. Or, you know, you're speaking out of turn. When the student is speaking out of turn, you can say things like, well, I'm going to ask you if you think it's your turn. I'm going to ask you if you're doing acting before thinking. I'm going to use a nonverbal signal to tell you that I think maybe you're doing acting before thinking. You want to have some way of communicating to the student about what the repair strategy is going to be. If you get out of your seat when it's not the right time, I'm going to ask you to figure out if it is the right time. If you forget to take turns in a game, I'm going to ask your friends to ask you to do turn taking. This last one is tricky because now you're getting the peers involved in helping the student use the repair strategy. I think it's a good idea to give the peers a way to help the student with ADHD. You just can't start with that. You have to really build a relationship with the student first, try out some of these repair strategies with them, and then see with the student's permission if some of the peers can use the repair strategy with them as well. Working memory list is another one that I commonly talk about. This can be time consuming. You start out with working memory lists for routine tasks where the student is commonly forgetful. The class entry routine, the class exit routine, the homework assignment routine, the book bag routine. Those are the common ones that occur in school. And the kids need to know exactly what the steps are. Very often they actually do know what the steps are, but they fail to complete the steps accurately. And so they have to have a way to check up on their own performance. And preferably you're not the one that's going to be checking on them all the time. So if you forget one of the steps for your morning routine, I'm going to ask you to check your checklist. This is, again, more difficult to do than it might first appear. It's very tempting to tell kids what to do when they've made a mistake. And I think probably it's more difficult for parents than for teachers. But what I really want parents and teachers to do is to get the student to verify his or her own performance. Another strategy could be, I'm going to stop by at the end of each lesson. I'm going to do a checking procedure with you just to find out if you made any mistakes by accident. That way you can fix them. If you pre-schedule the check-ins, it makes them feel less confrontational. If it's just part of the workflow for you and the student, I think it's a way to make your feedback more receptive. If you're getting too creative, I'm going to ask you to tell me what you're focusing on so that you can then turn your focus back to your work. Again, this is just an intervention to help a student who's becoming too distracted, but also to remember what they're supposed to be working on. Another strategy that I think is really important is to co-develop the plan with the student. So if you're able to get through building a relationship, if you're able to get through making observations and interpretations, and if you're able to share your plan with them, then you can also ask the student to tweak the plan or to improve the plan with you. So I want the student to have some control over when corrective feedback is going to occur, for example, or how. How should I remind you if I notice that you did acting before thinking? And a nonverbal signal could be really useful here. How should I remind you if maybe you forgot something? And, you know, tapping on the desk is a low, doesn't bring too much attention to the student so that they're then prompted to use the reminder system. And then also the frequency. I think it's important to not necessarily provide corrections every time you see that there's a mistake. Rather, you should have it pre-scheduled and make it part of your workflow and make it part of the student's workflow. It just makes it much more palatable for everybody. Okay, I'm going to quickly summarize here. The core difficulties with attention deficit disorder include underdeveloped inhibition skills and working memory skills. They lead to impulsivity and forgetfulness, and they lead to problems completing tasks. They also lead to poor planning skills, and we weren't able to talk about those today, but they have a big impact on learning, especially at the elementary school level, so grades 4 and up. The strategies to circumvent inhibition and working memory difficulties can be co-developed with their students. And the goal is for them to gain insight into their difficulties and for them to be able to develop strategies that help to improve their performance. So I'm going to stop here. I want to pull up some questions, some really thoughtful questions that came my way, and you're certainly welcome to add questions to the list. I'm just going to open up my other computer here, and maybe I'll just turn on the camera so you can see me. There we go, back in my office in Boston. So one of the questions that I got was about attention deficit disorder and executive functions can be comorbid. Most people aren't familiar with executive functions. Why isn't it listed in the DSM? So I'm actually arguing that ADHD and executive dysfunctions aren't comorbid. They're really kind of one and the same. Many clinicians would agree with me that that's really what constitutes ADHD. If you think back to that long list of 18 symptoms that I shared with you straight out of the DSM, the first 9 are really about working memory and not being able to suppress distractors. And there was that one symptom about planning. The second 9 symptoms are about arousal, in fact. And in the book, there's a separate chapter that talks about regulating arousal and regulating emotions. So there is more than just executive functions at play for kids with ADHD, but most of us would think that it's a problem with impulse control. I think the reason why executive functions isn't listed in the DSM is because it's actually not an observable behavior. It's an interpretation of an observable behavior. So all of the symptoms of ADHD we attribute to executive skills or executive dysfunctions. It's a really good explanatory model. It helps us to predict how the children are likely to behave in certain situations. But the executive skills construct itself really is an interpretation. So that was a good question. The next ones were, there were several questions about, what are some good phrases to use to help kids who are struggling with attention? And I think as you realized from the talk, I tried to get at that, like how do you start to have that conversation with kids about their difficulties with attention span? And what I really want to avoid is for kids to say, well, I can't do it because of my ADHD. And that's a question that comes up quite often, that kids would like to excuse all their behaviors on the basis of ADHD. So you have to turn that one around and say, well, given that you have ADHD, I want to know how we're going to get you through, and then it could be make your math sheet, how we're going to make you into a successful learner, how we're going to get you through the daily routine. So you want to sidestep that ADHD as an excuse, but really what you want to help the students with is help them understand their own behaviors. And then hopefully some of the tips that I gave you in the slideshow will point you in that direction. In fact, what I'd love you to do, if you have some suggestions for how do you talk with kids about ADHD, is to send them in as questions or as comments in on your screen. I can collate them and share them with you as a part of the slideshow today. I think it's a really great question. And you always have to kind of develop your own phrases for your own context. Another one was about motivating kids with executive functions. I think that's a critical question. This business of lack of motivation, very often it's the kids with attention deficit disorder that look like they lack in motivation. It's a topic that I discuss in a different chapter in the book. Every kid is motivated to do something, and you have to find what they're motivated to do, and you have to find some ways to celebrate their successes. So that's definitely one thing to consider about when you're trying to motivate kids. But the other one is, if you do have a rapport with them, and if you can help them to understand their own difficulties, and if you give them a way to get around those difficulties, there's a much higher chance that their motivation is also going to get higher. You and the student both are probably going to have to settle for something a little bit less than what everyone else is doing in terms of the volume of work or the quality of work, especially when you're first starting out with training them around these strategies. So that's going to be a hump for the student to get through, is that they might notice that they're still making more errors or they're still not able to get through as much work as their peers. But if they really can tap into and buy into the strategies, I think the expectation ultimately should be that they perform as well as their peers, as long as the supports are in place. I had a question about what's the most successful strategy to use when dealing with children who have ADHD, both as a parent and as a teacher? Now, I'm not quite sure if this means that the parent and the teacher have ADHD, or if we're just looking for strategies that both parents and teachers can use. It does come up from time to time that I work with families actually relatively common that I work with families where one of the two parents has ADHD and then so does the child. It's actually really challenging. I think a standard line that I'll use for an adult who says to me, one of the parents that says to me that they have ADHD is, I'll say, well, that could be a real blessing and it could be a bit of a curse, and let's talk that through. So I try to find out how much treatment the parents got for their ADHD. It doesn't necessarily have to be treatment with medications, but they do need to understand their own disability. And they also need to understand how they work around it. And a lot of adults that I work with haven't gotten good treatment when they were younger, and they may or may not have a good way of explaining their own ADD. That said, I have colleagues with ADHD who are functioning extremely well. So it's a question of having insight into your disability and knowing how to work around it. Once a parent has that, they're actually a gold mine of information for the child with ADHD. So if the parent really understands their own ADHD, they can become an excellent teacher for the child who happens to have ADHD too. But it does take that self-awareness first. If you don't have awareness about your own ADHD, it's so much more difficult to be a parent for a child with ADHD. I suspect the same would be true for a teacher with ADHD. It requires a lot of advanced planning. So I'm hoping I'm answering the question there. I think that was where that question was heading. And then as a retired school social worker, I'm increasingly aware of the missing component, education and involvement of the parents. How are parents included? So I might have partly answered that question with the information that I just shared with you a couple of minutes ago. The way that I include parents is to talk with them about their own ADD, if that's what's going on. I talk with them about the ADD of their child. And then all of the strategies that I mentioned for use in the classroom are pretty easily translated into the home environment. The morning routine and the evening routine are kind of my two go-to places. Have a really good list, have really clear expectations, and then help your child figure out how to get through that list of expectations accurately and efficiently. And it's hard to see your own child failing, and it's hard to not give corrective feedback. And those are two things that we have to talk about a lot, is how do you reduce the amount of corrective feedback you give, and how do you help the child do self-correction more? And then I think I have, well, maybe I have time for two questions. I have one more question here. One of the listeners is interested in evaluations, strategies, and measurable goals that can be crafted for IEPs. I think it's a fantastic question. One of the things that commonly happens for the students that I work with ADHD is that they have an accommodation plan, which means that the adults have more work to do to help the student perform better. But I always worry about the students then relying on the adults to help them circumvent the ADHD, and there isn't any teaching or self-advocacy involved. Sometimes there is and sometimes there isn't. I think if you're thinking about an IEP, that's a great goal to have, is can the student describe their own ADHD? Can the student describe situations where their executive dysfunctions have gotten in their way? Can the student describe strategies that they use to repair the situation so that they're able to perform successfully? So use of repair strategies, the richness of the description of their own behaviors, those would be fantastic goals and objectives to have in an IEP. And then think carefully about the students that you know with ADHD. How many of them have the level of insight required to do what I just said? My anecdotal experience is that for young kids, like the 5 to 9-year-old crowd, more or less, they don't have insight. They're not able to see their own difficulties. They can see it when they really do a lot of rule breaking. They get a lot of corrective feedback about that, so they notice that. They can't explain it. So I can get some level of insight around there. But to really understand your own behaviors and look at your own behaviors is something that we are thinking more of middle school students and high school students as being capable of doing. So you may need to adjust your goals and objectives slightly depending on the child's age. The other one is for planning. Planning is a skill that's really critical for learning starting in about grade 4. Kids with ADHD need a lot of supervision and support for planning. And hopefully if you play it right and if you teach them the planning skills, by the time they get to middle school, they're slightly better off. The challenge always is that with each increased grade, the expectations also get higher. So even if you really train the student super well, by the time they get to grade 4, all the other students in grade 4 have already moved on to a higher level of functioning, and the expectations and the demands are quite a bit higher. So the kids with ADHD are always kind of chasing their tail. But I think it's so important to provide the supports and to make them as independent as possible in using them. So it's 2:30 now. I want to respect the time interval. I'd be happy to take more questions offline. And I really appreciate having the chance to talk with you. And I hope that you're all surviving the coronavirus situation as successfully as possible. Thank you. Bye-bye.
Thanks, everyone, and thank you, Dr. von Hahn, for a great presentation and answering these questions. Like Dr. von Hahn said, I know many of you submitted questions live today that we didn't get to, so we'll follow up with those offline. I do have a special offer from Brooks Publishing. So we are offering a 20% discount on all of our products, including Dr. von Hahn's book, Essential Skills for Struggling Learners, through the end of June. So anyone who watches this webinar or the recording can use the code COFFEETALK at checkout to receive their discount. Please note there are a couple exclusions for our online products and pre-discounted bundles, but it is applicable for most products on our website. And if you're looking for more professional development webinar opportunities over the coming weeks, be sure to visit the Brooks Publishing website using the link on your screen for the latest additions to our Coffee Chat series. So feel free to tune in and check periodically. We are adding new presentations every week. And if you are looking for additional support, you can visit the URL on your screen now for additional resources, including recommended reading, downloadable resources, and professional development webinars from both Brooks and other leading organizations. So again, we want to be respectful of everyone's time. So thank you so much, everyone who attended, and thank you very much to Dr. von Hahn for this great webinar. We really appreciate you being with us. Thank you.
Thank you, Brianna. Bye-bye.
Goodbye. Thanks, everyone.